What causes problems with impulse control? Have you ever wondered why some people struggle with impulse control? It turns out that the reasons are quite complex and often linked to brain function and experiences, especially trauma. Impulse control problems can arise from disruptions in how the brain operates, influenced by trauma, mental health conditions, and environmental factors. When we look at post-traumatic stress disorder, or PTSD, we see a clear connection between trauma and difficulties with impulse control. Traumatic experiences can change how our brain works, especially in areas that help us manage emotions and make decisions. For instance, trauma can affect the prefrontal cortex, which is responsible for judgment and self-control. It can also impact the amygdala, the part of the brain that processes fear and emotional responses. When these areas are altered, it can lead to heightened emotional reactions and make it harder to control impulses. This means that someone who has experienced trauma might find it difficult to think through their actions before they act. For individuals with PTSD, symptoms like hyperarousal and emotional dysregulation can lead to impulsive behaviors. This might look like making rash decisions or acting without considering the consequences. Common impulsive actions can include reckless driving, substance misuse, aggressive outbursts, or even self-harm. These behaviors can sometimes serve as coping mechanisms to deal with overwhelming feelings or to escape from painful memories. The constant state of being on high alert can make impulse control even more challenging. Research indicates that people with PTSD often show higher levels of impulsivity compared to those who have experienced trauma but do not have PTSD. This impulsivity can lead to risk-taking behaviors, including increased substance use, such as alcohol or cannabis. Interestingly, some studies suggest that lower impulsivity might help protect individuals from developing PTSD after trauma. Beyond PTSD, impulse control issues can also stem from genetic factors, developmental influences, and other mental health disorders like attention deficit hyperactivity disorder, bipolar disorder, or borderline personality disorder. Environmental stressors, substance abuse, and even neurological injuries can further complicate impulse regulation. Understanding the link between trauma and impulse control is essential for effective recovery from PTSD. Treatments that focus on emotional regulation, cognitive restructuring, and developing healthy coping strategies can be beneficial. In some cases, medications may also help manage symptoms. Recognizing impulsivity as a part of the trauma response can reduce stigma and support a more comprehensive approach to healing. In summary, problems with impulse control are influenced by complex interactions between trauma-induced changes in the brain, particularly in PTSD, along with other psychological and environmental factors. Trauma disrupts critical brain areas responsible for self-regulation, leading to impulsive behaviors that can affect recovery and overall quality of life. Addressing both trauma symptoms and impulse control difficulties together is key to effective treatment.